Hi, my name is Krista Arviso, and I am in Adult Health 2 at Aspen University. Today I'm going to be discussing peritonitis. So, to understand peritonitis, we must first understand the peritoneum. The peritoneum is the lining of the abdominal cavity. It is made up of serous membranes. Peritonitis is defined as the inflammation of the peritoneum. In order to fully understand this condition, the individual must be able to visualize the peritoneum in the peritoneal cavity. So here I have a demonstration of the peritoneal cavity and an example of peritonitis showing the inflammation. So this diagram gives a good illustration of what that will look like inside the human body. So let's first discuss pathology of peritonitis. Peritonitis occurs as a result of a localized or generalized inflammatory process that happens in the peritoneum. There are two types, primary and secondary. Primary peritonitis is caused by bloodborne organisms that enter the peritoneal cavity. Secondary peritonitis can be caused by trauma to the abdominal organs, ischemic bowel, pancreatitis, appendicitis with rupture, peritoneal dialysis, and perforated intestines or perforated peptic ulcer. Next, I have drawn up a diagram of peritoneal dialysis. This diagram shows the peritoneal dialysis catheter that a patient receiving peritoneal dialysis would have, and it gives a good illustration of how easy it is for microorganisms to get into this catheter and infect the patient, giving them peritonitis. Here's our patient, our abdominal cavity, the peritoneum, and this is the dialysis solution and the catheter going into the peritoneum. As you can see, this catheter goes from inside the patient out to the dialysis solution. Now that we have a good visual of how this looks, we can go on to finish discussing secondary peritonitis. Secondary peritonitis is more common due to abdominal organisms rupturing and releasing into the peritoneal cavity. The peritoneum is considered sterile, so bacteria or organ contents irritate the area and cause an inflammatory response. Usually chemical peritonitis occurs first, and then bacterial peritonitis occurs as a result. This can cause fluid in the body to shift to other areas and cause adhesions. Now that we have a good understanding of the pathology of this condition, let's discuss diagnostic studies that are done to diagnose it. Usually a complete blood count will be done on the patient to look at their white blood cell count. A complete blood count is also known as a CBC, and this is where we see the WBCs, or white blood count, that show the inflammatory response or inflammation going on in the body. This is how you can diagnose if a patient has an infection. You may also want to get an abdominal x-ray, ultrasound, and CT scan to look for ascites, abscesses, and obstructions. The patient may also need a peritoneal aspiration to look at the fluid in the peritoneal cavity. So this is when they're going to aspirate from the peritoneal, aspirate some fluid from that peritoneal cavity to check for different organisms such as blood, bile, bacteria, pus, or fungus. Moving on from diagnostic testing, we will discuss the clinical manifestations of peritonitis. Clinical manifestations of this condition include abdominal pain, tenderness over the area, rebound tenderness, muscular rigidity, muscular spasms, shallow breaths, abdominal distension, fever, tachycardia, tachypnea, nausea, vomiting, and change in bowel habits. Caring for a patient with peritonitis can be difficult for the nurse. The interprofessional care of the patient will include diagnostic assessments and management. The diagnostic assessment will include a history of physical, a CBC with differential, electrolyte studies, abdominal x-rays or CT scan, ultrasound, abdominal paracentesis, or a peritoneoscopy. Next, I will discuss a treatment plan and medications used for this disease. Treatment for the disease includes the use of antibiotics, surgical intervention to remove infected tissue or treat the infection, or removal of the ruptured organ, such as the appendix. Medication used for this condition include pain medications such as morphine, antibiotics to treat the infection, antiemetics to help with nausea, and opioids if the patient has had surgery. Using the nursing process to manage this patient, the nurse should assess the patient's pain as well as bowel sounds, check for abdominal distension, nausea, fever, abdominal guarding, and signs of hypolimic shock. Nursing diagnosis for a patient with peritonitis include acute pain related to inflammation of the peritoneum and abdominal distension. The patient can also be at risk for a deficient fluid volume related to fluid shifts in the peritoneal cavity, secondary to an infection. Goals for the patient would include relieving the patient's pain, remaining free from complications, and reducing inflammation. Implementation and management for this patient can be difficult. To manage this patient, the nurse should keep the patient on an NPO status, or nothing by mouth. They may need to administer IV fluids, insert an NG tube, and use low intermittent suction, and possibly oxygen if needed. The nurse may also expect to administer antibiotics, antiemetics, and analgesics. If the peritonitis is treated with surgery, postoperatively the nurse can expect to keep the patient on NPO status. Again, nothing by mouth. Keep the patient in a semi-Fowler's position, administer IV fluids, electrolytes, and provide blood transfusions as needed. Once the patient is recovered, the nurse will need to provide education on proper infection prevention, including proper hand washing. If the patient is receiving peritoneal dialysis, the nurse should educate the patient about cleaning the skin around the catheter, to wear a mask during dialysis fluid exchange, about not sleeping with pets, and storing all supplies in a sanitary area. I'm hoping by watching this YouTube video on peritonitis, you got a better insight into the disease. Thank you so much for watching.